I am Dr. Napoleon Espejo. I'm a family physician. I'm located in Fargo. I have been working at family healthcare for over 25 years. I've been serving patients since the beginning of the pandemic. This pandemic has touched me personally very closely. At the beginning of the pandemic, definitely the dynamics at the workplace were significantly changed. So we have to work from home. We couldn't see enough patients. We were afraid that this clinic will keep their door open. So it was a lot of fear at the beginning. But in terms of health impact, one of our coworkers died early in the pandemic. And more recently, I had very close two friends who have died. One was my age, about in their early 60s, but the other was a 34-year-old female who died in 4 days after she got infected. So this is touching us very closely, very personally. A lot of distress, a lot of suffering, a lot of tears. And throughout these several months of the pandemic, I had friends and patients who actually are, after 6-8 months of being infected, they still feel short of breath. They haven't returned to normal life. So we don't know what is the long-term impact of this disease. We started our vaccination process early. So as a medical provider, I was able to have the vaccines very early in Fargo, so that was pretty nice. After the first dose, I only had a local soreness in my arm. And then after the second dose, I had fever for 1 day. I didn't have any significant side effects, and I probably was one of the most affected in the clinic. So most people, especially young people, felt pretty good after the vaccination. So the side effects of these vaccinations are short-term. The consequences of the disease that we are seeing are unpredictable. Most people recover, but several maintain or keep symptoms like shortness of breath, swelling, some neurologic symptoms that after 6-8 months after being infected, they still have them. Definitely the risks of the vaccines cannot be compared with the risk of having the disease. The disease is much worse than the vaccine. A lot of patients are worried about the side effects of the medicine, of the vaccine. Many of them listen to their neighbors, their relatives. They look in the internet and Facebook. There is a lot of information, a lot of misinformation in social media. I tell patients that the best way to get information is coming to the office. If I've been taking care of patients for several years, my interest as a physician is to seek the best for my patients. I want them to live a good quality of life and to live a long life. So I'm not going to hide any information from the vaccine. So I am going to tell them what's happening. The only death that has been reported related to a vaccine is blood clots in the lungs. They are very minimal. They are one in more than 2-3 million people. So it's very rare. Most people can tolerate the side effects, but the likelihood to die with the disease is very high. It's much more than that. But people are afraid of the unknown. So showing them numbers, showing them statistics, sometimes it's not enough. So as a medical provider, we had to reassure them that we have experienced ourselves, our coworkers, and we are seeing that over more than 170 million people vaccinated, we have not seen significant numbers of deaths. But we have almost 700,000 deaths in the United States because of the disease. So that is very clear information. Therefore, people should get vaccinated.